Hello everyone, welcome to SCube TV. I am your host Rajni Bharara. Today on the show I have with me a pediatric neurologist. His name is Dr. Nataraja, and today on the show we are going to speak with him about the importance of neurologist and also about seizures. But before, let's welcome him to the show and also to the channel SCube TV. Hello Dr. Nataraja, welcome to SCube TV.
Welcome. Thank you. Thank you.
Yeah. Thank you so much for coming and thank you so much for taking out time and doing the show. So, Dr. Nataraja, without wasting the time, I would like to directly jump to the discussion topic of today's show, which is the importance of pediatric neurologists and also about seizures. So, let me start the show with my very first question, which is about the importance of pediatric neurologists. Can you please explain who a pediatric neurologist is and then what is the importance of a pediatric neurologist, especially in today's time?
Yeah. Okay. Very important question. Thank you for asking that question. Yeah. Pediatric neurology is a special subject that deals with neurological issues in the newborns, that is, newly born children and infants like less than 1 year of age, children, school going children, adolescent, up to 18 years of age. Any neurological issues from newborn to 18 years of age, that is pediatric neurology. So that is very important.
Mhm.
So common public not aware of pediatric neurology. So we have to find out pediatric neurologist. Why? Because neurological issues in children is not same as in adult. There is differs from adult
Mhm.
neurological issues. So we should find out the neurological issues from the children. Why? Because they won't reveal, they won't tell. We have to
Yeah.
find out the causes. We have to find out the symptoms by observation, by their behavior, by their school performance, for their memory. So, the pediatric neurology is very important to find out the cause and the signs and symptoms. Why? Because 50% of issues are solved by means of diagnosis only.
Mhm. 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 Okay, so then, Dr. Nataraja, also, what are the major symptoms or signs, or so while we are observing our children or the kids or the infants, so what are those signals or symptoms that we have to observe and we should look for if a child is going through some problem?
Yeah, common issues I am facing is developmental delay. That is normal kids after birth. They have to maintain the head. That is neck holding. Should achieve between 3 to 5 months. Should not
Mhm.
attain. There is we have to find out the cause. Then we have to find out asking the children mothers at what time child able to sit without support. It happened at 8 months of age, and at what age able to stand without support. That happened at 10 months of age. At what age he is walking without support. That happened at 1 year of age. If not attained at age, we have to find out. This is not a simple thing. It is a serious issue is there. Why? Because this is development main depends on brain issue, brain development. If not
Mhm.
happened at the time, we find out the cause. Then other thing is speech. Speech delay also is there.
Mhm.
Children should talk amma, father, papa, like in 1 year of
Mhm.
age. Not happen to find out the cause. Then other issues are seizures. Seizures also very serious issue. When
Mhm.
seizures are not controlled, in control, it affects the development of the brain. Child
Mhm.
may land in development delay and school failures, memory issues, cognitive issues, behavior issues. So many issues are there. So we find out the cause of seizure early and find out the seizure or not. Then we have to treat as early as possible. Early intervention needed in children. Then other thing is headache, school failures, then behavior issues
Mhm.
and strokes. So many causes are there.
Okay, okay.
Yeah.
So when I talk about brain development in kids, so what is the major reason for the problem that is occurring in the brain development of a child? If you can please explain about that.
Yeah. Brain development start from mother's womb
Yeah.
itself to up to 8 years of age. So 80% brain development in at 1 year of age. At 1 year of age. So
Mm-hmm.
so genetic causes will be there, environmental causes is there, and nutrition also is there. So many issues is needed for brain development. So
Mm-hmm.
any
Mm-hmm.
issue happened during brain development, like brain infections, any nutritional deficiencies, any trauma, any autoimmune diseases, any
Mm-hmm.
tumors. So it hampers the brain development.
Okay.
So we should concentrate on brain development.
Okay. Okay. Got it. Got it. So, doctor, also, when should we meet a pediatric neurologist and common neurological condition in children? If also you can please talk about this.
Yeah. Common neural conditions I explained previously. Global development, that means not attained at 1 year of age, not able to speak at 1 year of age. Then
Mm-hmm.
seizures like fits and school
Yeah.
failure, headache, sudden onset of weakness like strokes, and behavior issues like autism, ADHD. Then
Mm-hmm.
like that. That is the
Okay.
early intervention needed. The child is not attaining the neck holding, or not able to walk at 1 year of age, not able to speak, any school failures, any behavior
Mm-hmm.
issue, not able to communicate with the peers and parents and teachers. We have to find out early.
Okay. So you're saying so whenever you're finding these kind of problems in your children's or your kid, then at that time you should go visit a pediatric neurologist directly.
Yes.
Okay. Okay. So
Especially
doctor,
first
before
1 year of age.
yeah,
First
yeah,
1 year of age
yeah.
is very important.
Okay. 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 So, doctor, also, before I jump into my next question, I would also like to know from you that so when a baby is born, so what are the major tests or those reports that parents should have about the baby after the baby is born? What are the major tests that should be done?
Routinely, we need not do any test. If baby is healthy, no need to
Okay.
do. If child is adequate weight is there, like 2.7 to 3.5 is there, child is baby active and able to suck the breast, and no
Mm-hmm.
history of any previous abortions in the family. So
Mm-hmm.
we won't do routinely. In case of when we do routine test means child is low birth weight, not crying
Mm-hmm.
after birth, any seizures at the first day of seizures, any seizures, then
Mm-hmm.
not sucking breast, then only we have to find out the cause. The mother had any frequent abortions, then only we find out, do some test. So
Mm-hmm.
for that, we do some metabolic test. Some metabolic test means involves some metabolic test, some electrolyte imbalance, sodium, potassium, sugar test. Then the septic screen means any infections, rule out any infections.
Mm-hmm.
Then any imaging, child has any seizures at the first day of life, you have to find out the cause. MRI brain or blood test, find out the cause. The things.
Okay, okay, okay. So now let's talk about seizures. So, doctor, what are the common causes of seizures happening, especially in the children?
Yeah. Brain normally we need the active brain. Then only
Mm-hmm.
harmonious brain. Then only we are functioning normally harmoniously. When there is hyperactive brain, we are getting seizures. The hyperactive electric activity is more hypersynchronous activity. Then only we are
Mm-hmm.
getting seizure from the brain. So this is the hyperactive brain. So what are the
Mm-hmm.
causes of hyperactivity of the brain means any developmental defect from the birth.
Mm-hmm.
Usually we call congenital malformations like heterotopias. So many things are there. Then any trauma during the delivery, anything, any injuries, any infections that irritate the brain that leads to hyperactivity of the brain, any
Mm-hmm.
tumors, any nutritional deficiencies, then just some metabolic conditions, some some genetic causes. So many causes are there that hyperactive the brain. Then only we are getting the seizures. Main things
Okay.
hyperactive the brain. What are the causes of seizure? Some metabolic conditions like a low sugar also one of the causes for newborns. Low sugar, high sugar, then low sodium, low potassium, low calcium. These are the causes for hyperactive the brain leads to seizure.
Okay, okay. So when a seizure is happening in a kid for the first time, so the so the parents normally won't realize that it is, a fit or it is a seizure that is happening in our child. So how do we differentiate that this is not a normal behavior and this is a seizure that is happening?
Yeah, it needs special knowledge and experience also.
Okay.
Sometimes we may also miss so
Yeah.
many movements mimicking like seizures. Normally, seizures are like tonic movements like stretching, like clonic means jerking, like some
Mm-hmm.
myoclonic like jerk, like this is common movements. So In addition, that some non-motor movements are there, like staring look, some behavior issues like crying, some pauses in the breathing also, stop in between breathing also. Some behavior issues are there. So many non-motor movements also will be there. These are
Mm-hmm.
non-motor seizures. Sometimes mimicking like seizures, like mimicking conditions like during sleep, when in sleep, myoclonus are there. Some
Mm-hmm.
giddiness are there. Some extrapyramidal symptoms, that is chorea, dystonia. So many things are. All movements are not seizure.
Mm-hmm.
Seizures like seizure and convulsive type is there, like tonic-clonic movements are there. Non-convulsive type, staring look is there. Some seizure-like conditions are there. So we have to
Mm-hmm.
differentiate first, which is seizure, which is not a seizure. For that, we need to do video EEG are there. Video EEG means, so video, you have to record that movements.
Okay.
Same time, we have to compare the EEG. EEG is electroencephalogram that records the hyperactivity of the brain. So when the
Mm-hmm.
movements are there, we have to compare same time locked, same time
Mm-hmm.
EEG, find out any abnormality is there or not. And also, the video is very important nowadays. Special equipment, we have to diagnose the seizure and type of the seizure also. So video is
Mm-hmm.
very important now. So prolonged video EEG. So we have these movements are normal or abnormal. We have to find out that. Then what are the type of movements also very important video EEG. Why? Because so many type of seizures are there. I said previously tonic clonic
Yeah.
movements, mic movements. So that we have to find out the drug also. This for myoclonic just some selected drugs we have to give. If you mismatch the drug, you aggravate the seizure also.
Mm-hmm.
So for microangios, we should not give carbamazepine, oxycarbazepine drugs. We should not give. If you give, that it aggravate the seizure. For that, video is very helpful to diagnose
Mm-hmm.
the seizure and type of the seizure. It directs the which drug we have to give. So this
Okay.
video is very important to diagnose the
Okay.
seizure.
Okay. So, and also, what is the difference between a seizure and a febrile seizure? And what is the causes of febrile seizures? If you can please explain that. Am I pronouncing the word correctly?
Yeah, okay.
Okay.
Seizure is a hyperactive the brain. One event. Seizure
Mm-hmm.
is one event. Hyperactive
Mm-hmm.
brain. Epilepsy is recurrence of the seizure. We call epilepsy.
Okay.
Okay. Then seizure, febrile seizure means during activity of during febrile period. In child had fever, then we getting seizure. That is febrile seizure. Usually
Okay.
happen in children up to 6 months to 6 years of age. This is a normal phenomena. It runs in families, not all children.
Mm-hmm.
But in families, common only. There are two types of seizures are there: febrile seizures, simple and complex. Simple means only 6 months to 6 years of age. Seizure is like generalized means all four limbs are jerking and lasting for less than 10 to 15 minutes only. This is a simple
Mm-hmm.
febrile seizure. So this is
Mm-hmm.
6 months to 6 years. It is normal phenomena. It will go off after six
Okay.
years. Done in families. This differs from normal febrile seizures. Like this prolonged seizure means focus only one part by jerking. Then only recurrent seizures like not in 6 months to 6 years. Beyond that period, less than six
Mm-hmm.
months, more than there is a difference from typical febrile seizure. We have to find out that cause. We have to do MRI and EEG, some blood test, what are the causes for seizure, metabolic test, and imaging. Then it needs CSF also. That's why then we have to find out the cause of atypical fibrils. That is very important.
Mm-hmm. Mm-hmm.
For febrile, simple fibrils, we have give cold sponging, like we reduce the temperature early, and some anti-convulsants for transient period. For atypical febrile seizures like prolonged seizures, recurrent seizures, focal seizures, we have to find out the cause, treat long time. You have to look
Okay.
after a change. Why? Because development defect also will be there. Some this atypical febrile seizures.
Okay. Okay. Also, doctor, does genes have anything to do with seizures or brain development? The
Yes, yes.
genetics of the parents. Yeah.
Yeah. Genetics. So causes of seizure, so many genetics, one of the cause only. So many
Okay.
symptomatics is I said fever also one of the reason for
Okay.
seizure. Sometimes symptomatic seizures are there. Low sodium, low glucose, high sodium, high glucose. These are symptomatic seizures. Not all
Mm-hmm.
genetic causes leading to seizure. So only
Okay.
50% are causing genetics only. So many non-genetic causes also will be there. Autoimmune causes, infection, any infection, brain infection also. That is called meningoencephalitis. That is one of the reason. Some low
Mm-hmm.
sodium, low potassium. Then tumors also is there. Tumors
Mm-hmm.
also affect causing seizures. So genetics, one of the reason, not all causes by the genetics only, seizures.
Okay. Okay. So now let's talk about the diagnosis of a seizure. So how can we diagnose seizure?
Yeah, diagnose seizure based on semiology. What are symptoms of seizure?
Okay.
We have brain parts are there. Right side is different, left side is different. Frontal
Mm-hmm.
lobe, parietal lobe, temporal lobe, maximal. Part of the brain symptoms are differs. So we can ask what are the type of seizures. Then based on
Mm-hmm.
clinical symptoms, then video EEG, documentation. What the type of seizure? Then what are the seizure or not? Then imaging, brain imaging, then some blood test. So then we will, if you find out a seizure or not, then we'll proceed the treatment.
Mm-hmm. Mm-hmm. Okay, okay, great. So, when the treatment is going on, so what is the process or what is the procedure of that treatment?
Yeah. Once we diagnose the seizure, then we have to find a cause of the seizure also. We have to do MRI imaging also.
Yeah.
Is there any tumor is there? So we can remove that tumor. That is the one of the seizure option. If tumor is there, you have to find out seizure. Sometimes
Mm-hmm.
any infections are there, brain infection, you have to treat that one. Cause of the seizure. Then no cause is found. Idiopathic. No cause is found. Idiopathic causes are there. Then to treat this seizure, type of the seizure, medical therapy main. Medical therapy mean anticonvulsants like valproate, then heparin, phenobarbital, levetiracetam, brivaracetam. So many drugs are there. Start
Mm-hmm.
with medical therapy slowly. Then 70 to 80% kids respond with one drug only. 20 to
Mm-hmm.
30% very resistant seizure are there. Then we have to two drugs, three drugs. Then child may not respond with three drugs also. Then go for alternative therapies like ketogenic diet. Ketogenic is very simple thing, but we have to supervise that. Usually used to take carbohydrates predominant and less carbohydrate, less protein, less lipids. Coming to ketogenic diet is a type of treatment for epilepsy also. That is the three ratios of lipids, one ratio
Mm-hmm.
of proteins and carbohydrate. This is the one type of
Mm-hmm.
treatment for seizure. Medical
Mm-hmm.
therapy, then ketogenic diet, then surgery. Epilepsy surgery. Any tumor is there, you have to remove. Not tumor is not all. If tumor, we do not find any tumor also. We will do localize the where is the we are getting seizure by some techniques. We have put some electrodes, find out the where is the location of seizure, remove that part of the brain. That is the brain surgery, epilepsy surgery. Then again, deep brain stimulation, responsive nerve stimulation. So many alternative therapies are there for epilepsy.
Okay, okay. So, are there also the advanced treatment? Does it? I mean, does that treatment, that procedure which you have explained right now, that does that also fall in the advanced treatment portion of seizures, or that is
Yes,
different?
that is same.
Okay,
Adult,
same.
there is ketogenic diet, epilepsy surgery, deep brain stimulation, responsive nerve stimulation. These are advanced treatment. Previously, people are going to cracks, native
Mhm.
medication, and
Yeah.
one or two drugs only. Now we have so many advantages in epilepsy treatment.
Okay,
Even though
great,
we
great.
could not find out any lesion in the brain, also we
Hmm.
will find out that the location where we are getting the seizure focus.
Hmm.
Selectively remove.
Okay. So, doctor, also, what are the common cause and for development delay?
Pardon?
What
Hello.
are the common cause and what are the common cause for development delay?
Yes. Yeah. Yeah. The development delay means previously I explained that child may could not able to walk at 1 year of age, could not speak at 1 year of age. Main
Hmm.
because of brain issues only. Mainly
Okay.
during delivery. Yeah, during delivery, the difficult delivery means brain not getting sufficient oxygen, sufficient blood. Then only
Hmm.
brain damages that leads to this development delay. And before
Hmm.
birth also, any issues in the mother. mother had diabetes, in hypertension, in thyroid issues, in infections,
Mm-hmm.
the rash, then only these leads to less blood supply to the developing brain. Some
Mm-hmm.
genetic causes also is there. So, but mainly brain issues are leading to this development delay. After birth also, child is not getting sufficient nutrition also. Any head injuries in 1 year of age, any bleeding, any strokes, that leads to hampers the brain development, that leads to developmental delay.
Okay, okay. And also, what are the causes for school failure?
Yeah. Causes mainly health issues. We have to find out health issues. In child had any
Mm-hmm.
seizures, any cardiac issues, any seizures also. Sometimes absent seizures like child has staring look.
Mm-hmm. Mm-hmm.
That is that happened daily 100 to 200 times. So we have to find out the cause for seizure, school failure. Absent seizures commonly occur at school age children, like 3 years to 10 years of age. So we have to
Mm-hmm.
find out the absent seizures. Why? Because the seizure uses the extra energy. All energy uses for seizure. So less
Mm-hmm.
energy for normal development. So we have to control the seizure as early as possible. Then only brain
Okay.
development occurs. So
Yeah.
school failure health issues, we have to find out health issues like seizures and some other issues, and thyroid issues also we have to find out. Thyroid is common thing, hypothyroidism. That also is to brain dysfunction. Then some
Mm-hmm.
psychological issues also will be there. School going children, some anxiety will be there, depression will be there,
Mm-hmm.
then bipolar disorders will be there, then shy people will be there. Sometimes school related issues. They may not cope up with school discipline children. Sometimes
Mm-hmm.
they are lagging behind some subjects, social like science,
Mm-hmm.
English. So what are the causes for a school failure? Any it is health related issue or any psychological issue, the school issues. We have to talk with the children. What are the issues with the children? Find out these medical issues.
Definitely.
We to treat the medical issues, or else in a psychological issue like shy, anxiety, depression, we have to counsel the child. Are there any difficulty in adjustment with the school? We have to go and discuss with the children or teachers. Any difficulties in this there? We have to sort out there.
Okay, okay. Also, doctor, stroke also happens in children quite a lot. So, also, if you can please explain strokes in children.
Yeah, stroke not uncommon in children like adults. It also
Mm-hmm.
happened in children also.
Yeah.
Because yeah, stroke means the symptoms are like sudden onset of weakness, like unable to lift the hand, unable to walk, in a facial deviation, speech disturbance, and memory disturbance, and vision disturbance. These are all of sudden. So this is called stroke. Stroke is the two main causes of stroke. There is any obstruction in the flow of the blood. That is called ischemic stroke. Block in the blood vessel.
Mm-hmm.
So any block is there, the circulation is hampered to the brain. Then only leads to which area of the brain affected, then symptoms are happening. So
Mm-hmm.
mainly this talking main heart, congenital heart, children mainly congenital heart is there. By birth they have any defect in the heart. That leads to stroke. Sometimes any tendency of blood clotting, that is some genetic issues are there. So tendency to
Mm-hmm.
clot the blood, that leads to stroke. Sometimes sickle cell disease also not the cause of stroke. So these are the called block of the blood vessels. Some issues are there bleeding. So these blast of the blood vessel, that is hemorrhagic stroke called.
Mm-hmm.
Any malformation means that there is weakness of the blood vessels. That is we call aneurysms and AV malformation. These are the main causes of stroke in children. We have to find out the cause, whether it is ischemic means blood clot or bleeding. We have to
Okay.
do imaging and a heart scan, echo, then find out the cause and treat accordingly.
Okay. And what about the behavioral issues in children? Also, if you can please talk about that too.
Yeah, behavior is commonly autism, ADHD. These are main behavior issues. Autism means mainly social communication skills are not appropriate. Means
Mm-hmm.
if you call the child by his name, he has to see at you. He may not. That is normal phenomena. If child is not seeing at you by calling his name, it is important. So you have to think of autism. Sometimes playing himself, he is not looking up other surroundings. He playing his own world, and no
Okay.
eye to eye contact. No eye to eye contact.
Mm-hmm.
Sometimes repeated movements are there. repeatedly switch off the fan, switch on the light, and tapping, repeated tapping, and sticking up what he is feeling. He is not adjustable. That is
Okay.
the thing. He think that I have to win. Mine is correct, even though he is wrong also. So this
Mm-hmm.
social communication skills and repeated movements is there in the child in 3 years of age, less than also 1 year also we can find out that. This is think of autism. Other
Okay.
thing is ADHD means attention deficit hyperactive disorder, means not focus on the subject. That is attention deficit, not looking at. And hyperactive behavior means repeatedly moving one place to one place and disturbing the other peers. These are the behavior issues. Autism, ADHD, these are the common behavior issues in the children. You have to find out so many causes are there. Mimics are there for autism behavior issues.
Mm-hmm.
Like child has any hearing issues are there, hearing issues. That time he may not look at us. And
Mm-hmm.
in anxiety disorders also there. Sometimes anxiety, phobias. Then that time also they might look at us.
Okay. Mm-hmm. Mm-hmm. Yeah.
With this, we have to find out the cause and some hyperthyroid and also medical issues. So these conditions we have to rule out. This is real autism and like autism like conditions. Then
Mm-hmm.
treat accordingly.
Okay, okay, great, great. But doctor, also now speaking of causes, so what are the common causes and what are the major causes of headache in a child or headache in children?
Yeah, yeah, yeah. Nowadays, these advanced conditions, people are addicted to these mobile phones, are not going to outside, not less physical activity, then not taking proper food in time, lacking of
Yeah.
sleep, which are nutritional deficiency. These are the common cycle primary headaches, like tension headache. These are the
Mm-hmm.
tension. Sometimes, sometimes the child may have migraine also. Migraine means run in families. Migraine is a very atypical in children compared to others, adults. So
Mm-hmm.
repeated vomiting also is there. Repeated headache lasting more than 4 to 72 hours. Continuous headache, one side headache is there. Vomitings are there. Sometimes atypical migraine also will be there. Sometimes weakness associated with headache, weakness also is there. Sometimes. So these are the primary headache. Sometimes in a vision disturbance, visual disturbance also leading to headache. Then
Mm-hmm.
hypertension also. Some children also may have hypertension. Hypertension one of the cause of seizure, headache. Sometimes anemia. Anemia also child may get headache. Sometimes any tumors in the brain. Sometimes
Mm-hmm.
any stroke. Post ictal headache also will be there. Means after seizure also child may get headache. So we have to find out the cause for headache, then treat accordingly.
Okay, okay. So thanks so much, doctor, for explaining the causes of headache. But now, recently when COVID happened, so earlier it was only found in the older people and the younger people, but now it has become quite common in children's too. So the childrens are also getting, affected with the virus, with the COVID virus. So what are the effects of COVID virus in children? If you can also please talk about that.
Yeah, yeah, yeah. In COVID, affection of COVID in children compared to adults very less,
Hmm.
very less
Okay.
compared to adults very less. So on in COVID, only in children only mild symptoms are there. 90% of child infected with COVID, 90%
Mhm.
mild symptoms only, like mild headache, fever, loss of appetite, body pains, lack of these are mild symptoms only. Only less than 10% only are getting severe symptoms like
Mhm.
affecting brain, heart, lung, kidney like this. In that only ICU admissions are only 1 or 2% only, only very less. No
Mhm.
need to bother about this third wave, whatever Delta thing affecting the children. Only
Mhm.
less than 5% only affecting the severity of the children. So like very less. But we have to careful of kids regarding care of the children. So
Okay.
like if affecting neurological symptoms, person neural symptoms in the children with COVID, only like brain stroke, like seizures. Then after that, we are getting GB syndrome, like any weakness of both upper limbs and lower limbs, like that. But very less.
Okay. Okay. So,
Affection of COVID is very less.
okay. So
Yeah,
it might not hamper the kids as much as it did in the older people or in the younger people?
Pardon?
So I was saying that, okay, so the effects of COVID, it might not hamper the kids as much as it did the older people or the younger people.
Yes, yes, yes. They both are,
Okay.
if affects very less only. Older people is different from kids. Older people are, they have multiple comorbidities are there. They have maybe hypertension previously,
Hmm.
hypertension, diabetic, any previous stroke,
Yeah.
yeah, any dementia. So these when affects there is more serious. Kids are very less. The kids,
Hmm.
if you have
Okay.
previously anything, any epileptic children, any Down syndrome children, then only the severity of the COVID affection is more.
Virus.
Normal healthy
Okay.
children, the severity of the COVID is very less.
Okay, okay, great, great. So, Doctor, before I let you go, coming back to seizures, so there are also a lot of myths associated with seizures that people normally believe in. So, would you like to burst some myths out today on this episode regarding seizures that you would like to address to the parents and also to the kids who are watching the show?
Yeah, 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 yeah. Once Caesar is there, parents may got disturbed, so many depressed also. So they
Mhm.
don't think they don't know what the cause of seizure also. Sometimes they brought the child to the quacks. They don't know how to treat the quacks. Sometimes they
Mhm.
go to the native medication also. That is very dangerous. So then parents also thought that once seizure happened in the child, life has gone like that, some depressed. So what I'm advising is the child is having seizures, so many simple seizures also, symptomatic seizures like simple febrile seizure also will be there. Sometimes simple sodium imbalance, glucose imbalance also some seizures are there. So we can treat that. Only 20% are resistant seizure. For that also, we have options like epilepsy surgery is there, ketogenic diet is there, DBS is there, responsive stimulation. So many alternatives are there. So many celebrities are having seizures, like Janty Rhodes had international player. He had epilepsy. He had seizures.
Mhm.
Isaac Newton is epileptic. So many have seizures in their life. So we have to make them an idealistic, make them role model. So one
Mhm.
child, any seizures, we should not, you need not depress. We have so many options. First, we have to diagnose seizure. Is seizure or not? Any moment is not a seizure.
Yeah. Mhm.
Any moment is not a seizure. Diagnosis is very important. So once we diagnose only, you can give proper ideal drug. It will respond well. 70 to 80% will respond with one drug. Only 20% only not responding. For that,
Mhm.
we have so many options. So,
Mhm.
2, 3 drugs are ketogenic diet and epilepsy surgery. So many options are there. No need to bother. No need to depress. No need. Don't go to quacks.
Okay, okay, great. So, doctor, so if we are seeing the early signs or signals of seizures, can be prevented from happening?
Yeah, yeah. The
Okay.
child had any like a non-convulsive like a staring look is there. Staring look is there.
Yeah,
We
yeah,
can
yeah.
call him, and ask
Okay,
keep the child silent. Ask the child sit calm. Then
okay,
yeah, so many provoking conditions are there for seizure. Provoking conditions make sometimes zigzag lights. They were getting provoking seizures also. Child has
okay.
seizure. Yeah,
Mm-hmm.
we have to avoid that one. Sometimes the child has any sleep deprivation, like a child is not getting sufficient sleep. Also, sometimes get seizures. Not
Okay.
taking proper food also time in time that leads to hypoglycemia. That also type one of the seizures. We can prevent that
Mhm.
sleep deprivation,
Okay,
hypoglycemia. Then this photosensitivity. These are
okay.
we can avoid the seizure.
Okay, great, great. Thank you so much, Dr. Nataraja, for coming to SQ TV and speaking with us. Thank you so much for providing us with so much information and so much knowledge. It was so lovely speaking with you. Thank you again for all the
Thank you.
details and
Thank you.
information.
Thank you. Thank you. Bye bye.
Bye. All right, guys, that's it from SQ TV. Keep on watching and do subscribe to the channel.